Okay, before the Haifu treatment, we will introduce the things we need. For the Haifu, the most important thing we will need is the gel. So for the gel, we can use the gel to transfer the energy into our skin. This is the 75% alcohol to clean the treatment tip. We can prepare the makeup remover and the cleansing milk if the patient is wearing makeup. This is the saline to clean the treatment skin. And this is the lotion to apply on the treated skin when we finish the treatment. And also we can prepare the hydrated facial mask. This is the dry and wet tissue to clean the treatment area. This is the disposable gloves for the doctor. So this is the things we need for the Haifu treatment. Okay, we're going to show the Haifu treatment in the face. And firstly, we will get the eyebrow pencil so we can mark the treatment area. And firstly, we can see we check the cheekbones and we draw a line. And then 2 fingers close to the ear. And 1 finger is away from the mouth. And we draw a line. And then we connect the lines. And also the jawline. So this is the treatment area for the 4.5, 4.5, and 3.0 and 1.5. And then we can get a treatment tip. This treatment tip has the distance. As this is the 25 millimeters, so we can place on the treatment area. And then we mark the treatment area and connect it. So this is the treatment area for the 4.5 tip and 3.0 and 1.5. And here we can touch the treatment area close to the eye, and you can feel there is bone in this area. And we do not treat on the eyeballs, so you can mark the treatment area by the feeling of the bones, so you can connect the treatment area. And this is the temple. Temple should not be treated. So this is the taboo area. So for this area is for the 3.0 and 1.5. And then you can connect to this area. So this is the check treatment area. So for this area, we can apply 3 treatment tips, 4.5, 3.0, and 1.5. For this area, we can apply 3.0 and 1.5. And then same as this cheek, then we can mark the taboo area of the forehead. As we can see, the middle of the forehead cannot be treated, so we can mark a line start from the eyebrow. So in the middle of the area, we do not apply any treatment tip on this area. So for the forehead, when the treatment skin or the patient is fatty, so we can apply 3.0 and 1.5 in this area. However, if the patient is like skinny, we can only apply 1.5 in this treatment area. So we can get a treatment tip. For this treatment tip, this is the maximum length. This is the 25 millimeters, so we can mark on the treatment area. So this is the treatment area of the forehead. So same as this area. So we are going to mark the taboo area of this side of the face, so we can start one finger from the mouth and then two fingers away from the ear, and then we connect the lines and the cheekbones here. So we connect them. So this is the treatment area for the 4.5, 3.0 and 1.5, and then we can feel the bones in the close to the eye. And also the temple should not be treated, so we can connect the treatment area, and then we get a treatment tip. Okay, and we connect together. So this is the treatment area for 4.5, 3.0 and 1.5. This area is for 3.0 and 1.5. And then we can mark the treatment area of the forehead. So for the jaw area and the nose cannot be treated. However, you can treat this fold close to the nose. So after we mark the taboo area, so we can proceed the treatment. Okay, after we mark the taboo area, and we will apply a thin layer of gel to the treatment skin. So we can start the treatment of the 4.5 tip. And we set parameter, and then we set the machine start and apply the gel evenly. And we can use our hand to lift the skin. As you can see, the skin is going up, so this can achieve a visible instant result. And we'll tell the patient we're going to start. And we will move the treatment tip 1 millimeter. As we can see, we have a line in this treatment tip, so we can move the distance like this, so we can continue. And after we have done like 10 shots, we can stop and ask the feeling of our patient if the energy is like too strong or not too strong, so we can adjust the parameter by the feeling of our patient. So we can see that 4.5, the end line of the 4.5 is here, so we finished this treatment area, so we can apply 4.5 in this area. So if the patient is afraid of the painful feeling of the treatment, you can apply twice in one treatment area. So for this patient, she's accepting the first treatment. I use the energy 25%. If the patient can accept higher energy like 50%, so you can apply only once on this treatment area. So I finished the. I applied one time on this area, so I will apply the second time because I use lower energy. However, if you are using higher energy intensity, so you can apply just once. So we always, the treatment method, we always go up. And you have to make sure that the energy is applied on the treatment area. And we do not apply the treatment tip on the taboo area. So we finished the 4.5 tip treatment. So we were going to replace a 4.5 tip, and we press these two buttons so the treatment tip is released. So we will change a 3.0 tip. And this is a new treatment tip, and we will take it out. And install it. And then we can set parameter. And if the gel is a little bit dry, so we can apply a bit more gel on the treatment skin. For the 3.0 tip, we can apply on the whole cheek. Then we will start the treatment. And we can also apply 3.0 on this area. For the 3.0 tip, the feeling may be a little bit stronger than 4.5 tip. And we can tell the patient before the treatment start. Okay, so we can also ask the feeling of our patient if the energy is like too strong, or they can accept the energy intensity for the current energy intensity. So if yes, we can go on to do the treatment. So when we are treating close to the eye skin, we must make sure the energy should not be applied to the eyeballs, or it may cause the accident. So we must be careful when we're treating the eye skin. We cannot treat on the eyeballs. So we finish this line, and then we can go on to do this side. For this 3.0, I also apply 25% So I'm gonna to do twice on this area to achieve a better treatment result. When you're using high energy intensity, the feeling will be strong. However, you can apply less treatment times in one single treatment. So when you are treating this side and you're not going to treat the temple area, so you can keep an eye on it. So I will apply the second time. Treatment method is actually the same, so we can continue to do this. And when we're moving the treatment tip, 1 centimeter, well, 1 millimeter will be enough. So we're going to do this side. So we finish the 3.0 and then we can apply the 1.5 tip. And we will set parameter on the screen. And for the 1.5 tip, we can apply the whole treatment area that we have marked. So we can start the treatment. The painful feeling will get stronger as the depth goes shallower. So 4.5 is like less painful, 3.0 will feel a little bit stronger, and then the 1.5. So for 1.5, I use 15%. And for the 1.5 tip, I will also apply twice on the treatment area. And then we can go on to do and we have to remember that the treatment tip must get close to the treatment skin. So if you are doing like this is not the right way to do. So for treating the treatment skin, the treatment tip always get close to the skin. So we can apply the second time. So we are about to finish this side of the face treatment, and we will go on to do the forehead. So when we finish the treatment skin or the treated skin will get a little bit reddish, which is the normal skin reaction. And some of the patient will have a tooth aching situation after the treatment, and this situation will last for 3 to 7 days and it will be gone. So after we finish the face treatment, we can go on to do the forehead treatment. Okay, we finished this cheek treatment. We can take a before and after picture, and for this treated and untreated picture to compare the result. So we will show how to do the forehead treatment. For this patient, she's like a bit skinny, so I will only apply 1.5 tip on her forehead. And the energy I will apply 15%. So we can apply gel on the treatment area, and then we can proceed the treatment. For some of the patient will have a stronger feeling on the forehead, so we can slide this treatment tip as well, slowly. So the painful feeling will be less stronger when we're moving the treatment tip. Okay, we can ask the feeling of our patient if we are fixing in one single area. The feeling is like painful or less comfortable, so we can move the treatment tip slowly. And we have to make sure that the treatment skin has gel on the treatment skin. Because ultrasound energy needs it to transfer into the treatment skin. So for this area, I will apply the shots as suggested on the machine. Okay, so we finished the forehead treatment.
Okay.
So we finished this side of the Haifu treatment, and we do not show how to do this side because the treatment step and treatment method is actually the same. And as we can see, the patient is a little bit mild bleeding because we have done the laser treatment after the Haifu. So we will apply the repair facial mask after the treatment, and we can take after treatment picture to compare the result, and after that we can tell the patient the after treatment care. And the rule number 1 is you need to wear a hydrated facial mask or repair mask for 3 to 7 days, and then you need to avoid direct sun exposure. Secondly, you need to take in some high protein foods, so it will accelerate the regrowth of collagen. And thirdly, and you need to avoid eating food that is like causing skin allergy, like the seafood, beef or mutton. So this is the after treatment care for the Haifu, and thank you for your attention.